Good afternoon. It's a great day. I'm listening to these stories. And before I start my story, I would like to ask you a question. How many of you have looked at yourself in the mirror today? I guess all, maybe more than once. So, looking at the mirror is not a big deal. But think about a situation when something happened to you, the face you look at all the time cannot recognize how you will feel about that. Obviously, it is very, very painful. So I will tell you about the story of severe barbaric act. But I will also tell you the story of winning the barriers, the courage, the bravery from within. These survivors have shown me has changed my life as well. So I'm talking about acid victims. Here is Neela. Neela was only 15 years old, and she's a great dancer. She wanted to be a dancer, but her father decided to marry her off. They found a man who is working in Saudi Arabia and well-off family, so obviously it's a good marriage proposal. Though her mother protested, but her father didn't listen to her, and they married her off. Husband went to Saudi Arabia, and Neela wanted to continue her education, but her husband, because she was so beautiful, was always in doubt that she may fall in love with someone else. So he wanted to take her to Saudi Arabia. She refused because that will curtail her dream of being a dancer or having good education. And in 6 months' time, this husband came back in one night and had an argument with Neela. And after that argument, Neela went to bed and suddenly woke up and saw that her husband is very angry looking at her, and she was asking, "What happened to you?" But instead replying to her, he threw acid on her, and the situation was like that. I don't want to now think about how painful it was. But the good thing is, within 24 hours of time, she came to Acid Survivors Foundation, and we had operated on her, and then she was like this in 4 months' time. But she knows that she will never get back her former feature. She has to accept her new look, and she has to rebuild her life. This is the situation of thousands of women in this country. Women are considered as a product, as a commodity, something like that we go to the supermarket to buy. If this girl is not mine, she will not be anyone else. If I want to keep it, I can keep it. If I want to destroy it, I can destroy it. This is the mindset of a patriarchal society. And very unfortunately, there was no support services for these people before Acid Survivors Foundation formed in 1999. I would like to remember Nasrin Haq, the late Nasrin Haq, who died in a car accident. And she first identified these acid survivors in 1995. And then in 1998, Dr. John Morrison, a UK citizen, joined to form this Acid Survivors Foundation. And in 1997, I first met Bina Akhtar, a survivor of acid attack, in a child rights seminar, and I was shocked, I was traumatized. I couldn't understand how a human being can do that to other human being. But I was also amazed to see the courage of that survivor. She was only 16 years old. She has given me that sense of beauty is not what we look like, The sense of beauty is what we are, how we interact with each other. As I said, there was no statistical information available before Acid Survivors Foundation was formed. So when we started to keep the records of acid attack, and we found that 68% are women who are attacked with acid. But there are also men who are attacked with acid. And I will go to the reason for this acid attack. Especially, you can see from this statistics that land dispute is the major constitute the reason for acid attack, 38%. But if you see other sides, like the rejection of love at marriage and sex offer, 18%, marital dispute, 9%, family-related dispute, 7%, dowry-related dispute, 5%, which constitute more than 30% of acid attack, which is completely gender-based violence. And from 1999 to 2013, we have identified 3,512 victims from nearly 3,184 incidents. That means in one incident, there are more than acid attack victims. And therefore, the number of victims is more than the incident. And anyone can be attacked with acid, from 0 to over 55. But major age group is from 13 to 35. And we also have seen that 46% attackers are from within the family. Someone you trust, someone you love, that destroy you forever. Because acid violence creates permanent disfigurement. Someone like, the husband or even father is, attacking their own family members. I remember Bubbly. We rescued her in the year 2000. She was only 7 months old when her father fed her with acid because she born as a girl baby. And when we rescued her, she was 10 months old, only 3 kgs weight. She was about to die. It took us long time, at least 1 year, to make sure that she has survived. She is now 14 years old. She is going to school in grade 7. She is a great dancer. But this is very difficult when the family members become the abuser, violating the human rights, because women are socially, economically dependent on men. And even children's identity is their father's identity. In this Bubbly's case, it was very difficult to go for legal action. But the case is still going on, very unfortunately. So, in this context, in this situation, the problem was so huge, and there was no treatment facility. When we started, there was only 8-bed burn ward in Dhaka Medical College Hospital, providing all burn treatment to all type of burn patient. And when I was visiting this burn ward, every day I was finding that someone is committing suicide or dying out of infection. There was only 5 plastic surgeons, and there was no plastic surgery courses in the country, so they were trained abroad. So the treatment is very expensive and time-consuming, and the facility is so poor, they were not receiving adequate treatment, and therefore they were living with huge scars, disfigurement, and disability. So they had to hide themselves. They were covering themselves. But when Acid Survivors Foundation formed, we took an approach which constitute comprehensive approach. The first one was our goal. The ultimate goal is to prevent acid attack, to stop acid violence. We want to shut down Acid Survivors Foundation. We don't want Acid Survivors Foundation to continue this country because we don't want to see any faces burned with acid. But we know it will take time to achieve that. So we have to have approach for post-violence response, and that constitute notification and referral, because acid attack is taking place across the country in remote rural places, and it's very difficult to identify them, and the treatment is only Dhaka based, so they have to come to Dhaka for burn treatment. So Acid Survivors Foundation developed a own hospital, 20-bed hospital. It's run in Banani, and the services is completely free, and it provides comprehensive burn management, including nursing care, plastic and reconstructive surgery, physiotherapy, psychological support, and it also provides long-term rehabilitation services. It works with the community for their better acceptance and inclusion. And we have been able to support nearly 2,500 acid survivors since 1999. Not only that, we have been able to transform many of the survivors to change agent. That's way these survivors, this change agent is actually providing psychosocial support to other victims and changing social attitude towards disfigurement and violence against women. And what we do, as I said, in this room, I see a lot of men attending this conference, TEDx 2014. As I said, 99% attackers of acid is actually men. But we found also men who are coming forward and raising their voice, demanding justice, protecting the rights of the acid survivors. And in 2002, over 5,000 men gathered together in Shahid Minar, raised their voice, demanded for a specific law on International Women's Day, and every year we do that. Media is playing a great role to make people aware about acid attack, what to do immediately after an acid attack, following up the cases, why they are not getting legal justice, and in that way creating social movement against acid violence. Celebrity. From the very beginning we have seen that's how celebrities are actually taking part in this movement. They formed Star Against Acid Throwers. You can see the then captain of Bangladesh cricket. Bangladesh cricket is very popular, is not it? Many of you watch cricket. And he formed these Stars Against Acid Throwers. And they have incorporated in their work, they're from the film industry, the art industry, the sports industry, and they are actually talking about against acid violence, mobilizing especially youth, and also students. They formed Students Against Acid Violence, and they are talking about acid attack in their institutions. Police is also taking actions, joining the campaign program. And from there, what we got? We got Acid Crime Control Act 2002. When we started, there was no specific law to deal with acid violence. But now we have Acid Control Act. Not only that, we also have Acid Crime Control Act for a speedy trial of the perpetrator. When we started, it was taking 10, 15 years, even in the lower court, to get justice. But now the average time for completion of a case in a lower court is 1 year. But I'm still not happy, because according to law, in 90 days, the case should be completed and the verdict should be there. But still, we are not getting that. And also, the conviction rate is very, very low, 10 to 12% only. And it's a very complex situation, the legal justice process. Acid attack is taking place at night when there is no witnesses. And as I said, the perpetrator is close someone, so it's very difficult to go for legal recourse. And also, there is no judiciary system, and the law enforcement agencies are, I should say, not working for the survivors. but rather sometimes they are protecting the perpetrators. And in that way, the conviction rate is still low. But with this, even then, we got a central monitoring cell for assessing all the cases. That is done by the Home Ministry. And also, the National Acid Control Council has developed a special fund to compensate the acid survivors. And I should say, the Acid Crime Control Act is very unique because this is for the first time has seen the rights of the victims, and therefore they have taken the provision for compensating the victims. And from this slide says, the upper graph, what could happen if there is no response? Because, as I said, the number of attacks was increasing at the rate of 40% each year when we started, and up until 2002. 500 people attacked with acid alone in the year 2002. But with effective, successful prevention campaign led by Acid Survivors Foundation and other stakeholders, including other NGOs, media, government, civil society, celebrities, everyone from this society, the number has gone down to below 100 last year. And the mission of Acid Survivors Foundation is to bring it down to below 50 by 2015. So this is possible. If we work together, this is possible. And we have seen, because of survivors' engagement in the whole process, actually it was possible to make it evidential what can be done, to sensitize the policymakers. When we had the first meeting with the law minister, it was very difficult to make him understand we need a law, because he said, this is a problem between two people. What can we do? And we said no. And then we organized a dialogue with the survivors and the policymakers. And policymakers said that, sir, if we don't act now, you are not safe, because the number of attacks is increasing, and anyone can be attacked with acid. So, to protect yourself, to protect your family, please respond. And policymakers responded, and we have the law. Therefore, it is very important to have survivors' voice heard. Empowering survivors is very important, and they are actively engaged in planning and in actions. And we got international recognition. This model has been recognized by different international bodies. And not only that, this model has been replicated in 5 other countries. Bangladesh is the first country which has enacted law to combat acid violence, and then Pakistan, and then Cambodia. And they followed the similar law, and now the India High Court is assessing Bangladesh law for developing similar law in their country. So Bangladesh is the world model, the pioneer in combating acid violence. And now my next challenge is actually mental health. I know my time is up, but if you allow me, I would like to tell you the story, because this is also alarming and which is haunting me for a long, long time. Before I go to any stories, I go directly to the statistics. Global scenario says that mental disorder is in 4th rank out of top 10 disease burden. 450 million people, 12% of world population, are suffering from mental disorder. And if you see in Bangladesh, the situation is worsened, actually. 16.1% Bangladeshi adults and 18.4% children in our country have diagnosable mental health condition. This is according to WHO survey conducted in the year 2003 and 2005. So the situation has worsened, I should say, because of the global economic situation and disaster-prone country. And we are talking about Rana Plaza. You have seen that many stories in the newspaper, how the victims of Rana Plaza, their psychological situation is, the post-traumatic stress disorder they are suffering from. Even the rescuer, they are suffering from post-traumatic stress disorder. So it's a big problem in the country. There are 10,000 people every year in our country committing suicide. Suicide obviously is manifestation of this severe frustration, and therefore someone can take off their life. Is not it? But do you know, in Bangladesh, according to existing law, suicide is a crime, suicide is an offense. Our great singer Nancy recently tried to commit suicide, and to help her, doctor will not go to rescue her according to our law. Police will go to arrest her because attempting suicide is a crime. And the facility we have is so poor. We have only 800 beds for 160 million people, psychiatric beds. 200 beds in National Mental Health Institute, which is situated in Dhaka, 500 beds in Pabna Mental Hospital, so 700, and other 100 across the country. And we have only 200 psychiatrists and 50 clinical psychologists. These are the professionals who can support them. And if we calculate, then we see that we need 13,000 psychiatrists in this country. So 200 psychiatrists can meet only 1% need of supporting these people. And we have, in Bangladesh, we have still follow the Lunacy Act, 1912, which is coming from old British law. Lunacy Act means we consider them lunatic. The mad people, the mad and bad should be kept outside of the society. And therefore, according to Lunacy Act 1912, that is trying to confine the people with mental disorder to protect the society. And in this situation, my next challenge is to address mental health in this country. And therefore, I have formed a new organization called Innovation for Wellbeing Foundation. And this organization is working with government, NGOs, civil society, media, and people like you to change the situation. We have shown that, yes, we can do it. We have reduced the number of acid attacks from 500 to below 100, and we will be able to do that for mental health. We will change the situation. Thank you.